Hi everyone, today we've got another specimen. This is number 452 in our collection, and the heart would have sat in the chest like this. So superior would be here, so head, inferior down here, so legs, anterior surface coming towards the screen, posterior towards the turntable, left here, and then right over here. We'll try to find what looks to be the right atrial appendage externally, and it looks like this would be it, kind of triangular shaped and broad based. So let's go ahead and open up the specimen here. And when we do open up the specimen here, we do find that there are pectinate muscles that spill outside of the confines of the appendage, consistent with the morphologic right atrium. We see what appears to have been the orifice of the inferior caval vein. When we look for other structures in the right atrium, it's difficult to identify what would have been the coronary sinus, or the mouth of the coronary sinus, I should say. There are some hearts that don't have a mouth of the coronary sinus. This appears to be one such heart. And then it appears that the oval window in this heart, or the oval foramen, is in fact intact. But what's striking and what immediately kind of jumps out looking at this heart is that there is a common atrioventricular junction or a common atrioventricular valve, and in fact that this heart does have an atrioventricular septal defect. And the atrioventricular septal defect here, let me try to open this up, sorry. The atrioventricular septal defect is here and does appear to have both an atrial and ventricular level shunt, right? And so a common atrioventricular junction, this is a heart with an atrioventricular septal defect, and so it makes sense to kind of turn our attention to the valve leaflets themselves. So this would be the kind of the right-sided components, and here is the superior bridging leaflet, and you can see that the superior bridging leaflet does have connections to the right side of the septum here, so consistent with kind of a Rastelli B type AVSD. This appears to be a small right anterosuperior leaflet of the atrioventricular valve. Then if we turn our attention kind of inferiorly, we find the inferior bridging leaflet, which has direct connections to the crest of the ventricular septum, which is right here. You can see these cords very nicely, and you can see how they insert into the crest of the ventricular septum here. You can also see nicely how there is in fact a ventricular level shunt to this atrioventricular septal defect. And then on the other side here, we can find the left mural leaflet, which we'll take a look at in a little bit. If we turn our attention to the ventricle itself, it seems to have coarse trabeculations. We do find that this ventricle does have a septomarginal trabeculation here, so consistent with the morphologic right ventricle. And then we come to the first semilunar valve here, which appears to have 3 leaflets, 1, 2, 3, and 3 sinuses. There are no coronary arteries that arise from the sinuses, consistent with the morphologic pulmonary valve. So now let's go ahead and turn the heart to its back, and let's find the left atrium. So here we find a smooth-walled atrium, consistent with a morphologic left atrium. Here is, trying to find this appendage. Here is the left atrial appendage. You can see all the pectinate muscles are confined within the appendage itself, so consistent with a morphologic left atrium. You can see the flap valve of the oval fossa here, and the horns of the oval fossa here, And once again, we find that the oval fossa is in fact intact. Now we'll get to look at this, the left-sided components of this atrioventricular valve here. And so here, in fact, is going to be the left mural leaflet. Here is going to be the inferior bridging leaflet, once again, and we see those connections to the crest of the ventricular septum here. And you can see that the ventricular septum has this kind of scooped out appearance, which is what is seen in the setting of an atrioventricular septal defect. And then, once again, we can find the superior bridging leaflet here, and we've already seen its connections to the crest, or to the septum on the right-hand side. All right, so this is the common atrioventricular valve from the left-hand side. If we turn our attention to this ventricle here, it's got fine crisscross tubeculations consistent with the morphologic left ventricle. And then let's take a peek at the outflow tract. So here is the left ventricular outflow tract. Once again, you can see this scooped out appearance of the ventricular septum, which is what we do in fact see in hearts with an atrioventricular septal defect. You'll also notice that the distance from the apex to the aortic valve here is longer than the distance between the left-sided portion of the atrioventricular valve and the apex. So put in a more sensible way, the outlet of this is greater than the inlet component, or longer than the inlet component of this left ventricle, which is also what is seen in the setting of an atrioventricular septal defect. When we come to this valve here, we do find that it has 3 leaflets. Leaflet 1, leaflet 2, leaflet 3. There are 3 sinuses, sinus 1, sinus 2, sinus 3, and these are just arbitrary numbered. And we do in fact see coronary arteries arising from within these sinuses. Thus, this is consistent with a morphologic aortic valve, and we can see the ascending aorta here, and then we can see head and neck vessels arising here. Note that there is some distance between the left-sided components of the mitral valve here and the aortic valve itself. And so we've got a heart with a common atrioventricular junction and a common atrioventricular valve, which would be consistent with what a lot of people would refer to as a Rastelli B classification.